Thank you for coming. Thank you for being here with me today,
Thanks
Dr. Rhee. So we're talking about Watson, IBM's Watson, which we know from Jeopardy as...
How many people have seen Jeopardy and Watson? Raise your hands. Oh, there's a lot of people.
It did pretty well.
Yes.
And then you saw it and said, hey, we should make that something that's going to improve healthcare.
Well, we saw it at IBM as an extraordinary opportunity. So let me go a little bit around this in terms of the history. So Jeopardy, as you know, many of you know, is a game show where humans are competing with questions and answers. And IBM has had a long history over its 105 years of taking on these grand challenges and being at the forefront of these major technological evolutions and revolutions. So if you think about the history of IBM, we were part of the first systems that counted, that helped contribute to the census. And if you imagine, I mean, everything was paper-based then, and then we helped craft systems that counted. We helped create the first computers and that are programmed. And so those are the computers that you have today, many of which, mobile phones kind of meet that. And then we looked at this new system of a system that's cognitive. And so we wanted to demonstrate its capabilities after investing quite a bit of time and energy on the show of Jeopardy. And then we weren't going to stop there. We were very interested in the role that it would have in health and healthcare. And so that is kind of the transition.
Okay. And that launched about a year ago, a little over a year ago, IBM?
Yeah,
Watson
so
Health.
we have a commitment now. We call it our moonshot. It's called Watson Health. And it is this commitment to transform health and healthcare globally around the world to improve health outcomes and look at ways in which we can also do it at an affordable cost.
Did you think of a more ambitious mission?
So, we like to say at IBM, we want to be essential. And so we do believe it's an essential mission. If you look at health and healthcare across the globe, healthcare is $8 trillion across the globe. In the US, we spend about $3 trillion. That's about $10,000 per person. Each of us are payers in the current healthcare system that we have. We're all contributing to it, either through our employers or taxpayer dollars. All this contributes. And so we have this mission of being essential, and we believe health and healthcare is a perfect place for that.
And let's get into how you do that. So now we have the Affordable Care Act. A lot more people have access to healthcare, have insurance, but we still have these tremendous healthcare costs. And I know that one area you've targeted is waste within that system. That something like 30% of the healthcare costs are unnecessary or wasted costs. Can you talk about how Watson could theoretically help us cut costs in that domain?
Yeah. So one way I like to frame it, and I actually I reflect on my time as a physician where I was practicing every day and 70-hour weeks and seeing patients, maybe 40 patients a day, and it was all paper-based at the time. I would consider the challenges that doctors and healthcare professionals have as a big data challenge. So in that setting, you've got, how many people remember paper-based charts? Raise your hands. Yeah. How many
we
people?
Still have them in some places.
In
right?
some places we do, and especially as we look across the globe, there are many places that have them. But how many people have now an electronic medical record with your doctor? Raise your hands. So it's extraordinary. Over the last 10 years, I'd say that so much of the data that and I've gone through those electronic medical record type of transformations is now in systems of record that can be read and that can be understood and that can interact and support a doctor to make better healthcare decisions and support a patient and other stakeholders in health and healthcare. So what I like to say is that as you think about big data, there are 4 V's of data that we often like to reference. So there's the volume of data. Each of us as individuals will produce 300 million books worth of data in our lifetime. You're like, okay, that's a lot of books. And what is that? That's genomic data, that's clinical data, that's behavioral data, that's social environmental data. There's a lot of data out there that could potentially give the healthcare professional, and I know you're one as well, right?
Sort of.
Yeah, you are. It's a great background we talked about, but this idea of a doctor's visit being 15 minutes, we still got 20 right here, but that's about how much time you have to understand a patient in that interaction. There's a lot of data in those medical records, in the literature, in the journals. It's humanly impossible for any individual to know everything. And what Watson is, what cognitive is about pulling the data from those different sources, putting it together, applying intelligence to it, and providing an insight to that key stakeholder, that key person, whether it's a doctor. So I've seen it in Bummengrad Hospital. I've seen it in Memorial Sloan Kettering. There's the opportunity to provide insights to an oncologist at the point of care, for example, like an area like breast cancer. There's over 800 treatment options for breast cancer. To be able to help provide an insight by looking at potentially the medical record, the medical literature, the studies that just came out, and help that oncologist during that short visit be reminded of something that they may not have thought of is the power of cognitive, the power of providing a key insight, translating that big data into an insight. And that is the role of humans and technology together in this new era of cognitive.
Right, and that's a big point that you emphasize often, is this is not replacing doctors.
No,
this is making doctors able to deal with all the data that they'll have to deal with as it comes at them.
Yeah, it's about supporting people with these key decisions. It's about translating that big data, of which we often like to say 80% of that data is unstructured. It's in the system of record, so you can look it up, but you're not getting insights from it. So it's about pulling insights that can help predict, help you better personalize, help you prevent a bad health outcome, and also help you promote health. And this is a very key point. We were talking about it before. There's a reason why I'm not called the chief medical officer, which is the traditional term.
Right, you're chief health officer.
Chief health officer, because I mean, medical is, medical doctor or access to medicines. Those are all very important part of healthcare. But health is so much more than healthcare. And it is, like I like to use the acronym HEALTH, is housing, education, access to healthy choices, labor and employment, transportation, a holistic view of health. And that's what's exciting now, this opportunity to recognize that we can bring all these different data sources together and provide a personalized insight to you as a patient, to me as a provider, to a life science researcher, to a payer, to a policymaker, to a broad range of stakeholders, so that they can hopefully make better decisions.
So you're talking about health not just as the absence of disease or infirmity, but as the actual positive state of well-being. Can we talk first about the disease and that understanding of health with the example of Memorial Sloan Kettering, which you've been working with as Watson Oncology specifically?
Yes.
So if I understand correctly, it is the supercomputer, and I'm sorry I always anthropomorphize the computer, which I'm not supposed to do.
It's okay.
But he, Watson, or she, is learning from the oncologists at Memorial Sloan Kettering in a way that is able to be transferred to other hospitals in other areas who might not have access to the expertise of those oncologists.
Yes.
Here at a great institution.
Yes.
Is that right?
Yeah, so you think about it here, and I've referred a number of folks here. I mean, if you're here in this community, one of the great assets, one of the great important parts of this community is Memorial Sloan Kettering. You have access to the best cancer specialists in the world here. And so this idea, and we took this on right after Jeopardy, of training, of working with Memorial Sloan Kettering, getting those best oncologists, having Watson learn from those best oncologists, and having basically a tool to help as a trusted advisor for oncologists all over the world, potentially, or in any community, providing access to a cloud. It could be on a mobile device. And now it's being delivered I've been there in Bangkok, Thailand. I've seen the oncologists who are using Watson for Oncology there. Manipal Hospital in India, China, Korea, we just announced last week. This idea of democratizing access to knowledge through the power of technology so that the same expertise that you would get in this community can be shared in other communities is such an exciting part of why we're doing this.
Right. So what's an example of something if I were an oncologist in a more rural area and I was using Watson? What's a question that I could answer with them.
So right now, it's on the amazing amount of treatment options. So remember I talked about the big data. There's medical records, there's textbooks, there's journals. So Watson for Oncology has 300 medical journals, 200 medical textbooks. It can read millions of pages in a second. It can look at the updates of the literature, because I mean, if you see every day there's typically a news article on some type of piece. And it can find news articles that aren't covered, right, in the general news. So it looks at all of that, and it provides that insight to the oncologist on what treatments he or she should recommend. Providing access to the cloud, it could be provided in a rural setting, it could be provided in an urban setting, it could be provided in a suburban setting, and it could be provided all over the world.
So medical students can not have to memorize so much.
So we talked about this a little bit. We were both medical students, right? So we know how much of that is about memorizing and remembering things. I would say that one thing we're seeing with this new era of cognitive is, and I would personally say that there will be a different future of how people are trained, where you're trained with because frankly, I was trained with paper-based notes, and I remember I would spend hours looking for radiology reports at different hospitals, and I would do a lot of what we call grunt work.
Yeah.
What's exciting now is all this data is in systems of record, and the role of a cognitive system to support providers will be a very important part of how we deliver care, and also how we train the new generation of healthcare professionals.
So I did my internship in 2009 to 2010, and I'd be in the middle of the night needing to get a fax from some other hospital of someone's medical record, and it would be 300 pages, and I'm waiting for the fax machine, and I'd be getting pages on my pager, which I'm pretty sure is still, and that felt so obsolete. And then to move toward a supercomputer cloud with all this data seems just a complete sea change in culture of what's available in the healthcare system. How do we manage that investment? How do you justify it? How do you get systems to take it up?
So you are highlighting a big transition that's occurring in healthcare. So yeah, I remember those nights where I'd get pages. I remember the paper-based records. I remember how antiquated things felt and how I would have to scan a medical record, sometimes with an emergency situation, just flip through a chart, and when there are urgent situations that occur. So this idea of translating that data into insights is transforming healthcare. And I always believe there's a culture that you need to, a change management system you need to consider as well with that. And so what we've seen and we're seeing is that when it comes down to the fundamentals of what healthcare is about, it's about relationships. It's about empowering a patient, a provider, and also other stakeholders in that health and healthcare ecosystem to improve the health of a person or a population. And with that goal in mind, to have technology play an important role, to have cognitive play an important role in supporting that, people are embracing it, and people are continuing to embrace that, because that is the culture of medicine, to want to improve the health of the people you serve.
And how does this factor into, as our populations are aging, we're talking about aging today, why do we need big data and cognitive computing, especially to benefit older population?
Yeah, so I think about, and we talked about this too, a little bit, what was the age of the population, life expectancy here in New York about 1900? Do people know, approximately? 47, very good. Yeah.
Wow.
That was pretty good.
Yeah.
So 47, and what have we gained in about 120 years? How many years of life expectancy? What is it now? 77, 80, yeah. I was just in Japan, in Tokyo. I mean, that actually is the country that has the highest life expectancy, like around 83, 84. We just announced a partnership with Italy, which has the second highest. So I was there with Prime Minister Renzi, and he talked about we're going to beat Japan because they're right next. And we have so we're intrigued in looking at Italy, for example, and seeing what is it that makes people live longer here. And so we have to think not only disease, we have to think about health. But I want to bring this back to the context of what's happening in developed countries, which we've achieved extraordinary increases in life expectancy, partly because of healthcare interventions, but partly because we've seen the broader interventions that work. Food and water safety, refrigeration, road traffic safety, vaccinations. There's such a broad range of different areas that play a role. And what's exciting now is the world is flat, as it's small, and I was just talking with our team about Congo. I mean, sub-Saharan Africa, there's extraordinary opportunity to increase the life expectancy in the short term compared to what we have done in the long term. Over 100 years, I believe that the world will be more flat as it relates to life expectancy. Places like sub-Saharan Africa will acquire more life expectancy much quicker, partly because of the role of technology, partly because of the knowledge that we have in different settings. And so as I think about my father, who I was just with last week, who's 81 years old, and he's got a number of health conditions. He's got cardiac issues. He's got some other issues as well. I took him to his doctor's appointments, and actually there were some things that came up that were pretty emergent. But I frankly, with his permission, track him with his wearable, with his
permission.
Yeah, with his permission. And this is a very important piece. We have a community where me, my dad, my brother, our spouses, we all step challenges. And so what's fascinating is I get to see, he averages around 8,000 steps a day, which is better than,
Wow.
Some days much better than I do. But when I notice that he's not doing as well, like 2,000 for a few days, I call him, I'm more proactive. This is where this idea of instrumenting, this idea of with people's permission, this idea of connecting the data, not just the data that's in the exam room walls, there is an extraordinary opportunity as we think about aging. And so when we were in Japan, we were talking about this partnership we have with Apple, where with the postal workers, who often see a very aging population as they go around, they're giving these apps and these iPads to seniors to help them do with self-care, help them be connected to individuals through things like FaceTime. That's a very important part of health too, social connectedness. And there are ways in which we can bring this data together, use a system like Watson, a cognitive system, to help find different patterns, predict potential things that we need to address, and then personalize the interventions and prevent, hopefully, a bad outcome and promote a healthy outcome. And so as you think about aging and this, the aging population, the role of technology in supporting the elderly, I think, is a very important piece. Because we're, frankly, a generation of caregivers as well now with the baby boomers. So we're looking at ways in which technology can support that.
And I think that brings it back to the question about cost kind of at the top, that I've heard it likened to having sort of a dashboard of data, and instead of, you don't take your car in every year for a regular checkup, you sometimes wait until it seems like something's wrong, or like there's a check engine light that comes on, and if you're watching your data, you can go in and calculate at times when it seems like something is off in the data, as opposed to just randomly going to see doctors when it might not be necessary.
Yes, and so you referenced waste in some ways. There's what's known as unnecessary visits. There's unnecessary hospitalizations, and as I highlighted earlier, we're all spending about, in the US, $10,000 per person for healthcare, if you look at on average. There are ways in which we can reduce the waste issues. There are also ways in which we need to promote these good health outcomes. And so we're thinking about health much more holistically than just physical health. We think about physical, mental, social. Purpose is a very important part of health. And financial is an important part of health.
Yeah.
Your zip code often has as much relevance as your genetic code to your health outcomes.
So everything is health.
I like to say everything is health. And,
Yeah.
I mean, ultimately, there are key aspects of this where you need to personalize it for each individual. Because as you can imagine, different strokes for different folks. Different people value different aspects of their health differently.
Right. I have a lot more questions, but we only have a minute and a half, so I can go to the audience.
Hi, David Golish. I believe IBM has made over $7 billion of acquisitions in healthcare. How do you plan to make money off of this?
So, so the investments that we've made are definitely important to put this opportunity together, to transform health and healthcare globally. It's fundamentally about improving lives and helping improve the populations. We believe if we do the right thing with our partners, then ultimately the other things will follow.
Okay, I guess we're out of time. So thank you very much. Give a hand for Dr.
All right,
Rhee.
all right. Thanks.